Bed sharing between infants and new mothers is common but extremely dangerous. The act can lead to sudden infant death syndrome and other sleep-related deaths in the first year of a baby's life. Temple University Health System rose to the challenge of addressing these risks. A task force of nurses and physicians developed the Sleep Awareness Family Education at Temple program, also known as SAFETY. The program educated postpartum women and their families about safe newborn sleeping practices and provided new mothers with a safe sleeping space for their newborns. During the program's educational sessions, specially trained nurses met with mothers and their families to teach the current recommendations for infant safe sleep and provide the family with laminated door hangers that summarized key points. Every baby received a cardboard bassinet. Each bassinet had baby essentials, including a onesie, hat, wearable blanket, thermometer, nasal aspirator, baby wash, diapers, wipes, and socks. Parent supportive items were also added, such as a children's book about safe sleeping, condoms, an immunization card, and a list of community resources. The SAFETY program yielded significant results. To measure success, a control group and an intervention group were studied. Among the control group of 1,687 patients, 6.3% reported bed sharing, while the intervention group of 1,076 subjects practiced bed sharing at a rate of only 4.3%. Bed sharing in the intervention group was reduced by 25%. For a leading-edge approach to reducing bed sharing and the risks associated with it, we are delighted to recognize Temple University Health System as the third-place recipient of the 2017 Delaware Valley Patient Safety and Quality Award. When a patient is admitted to the intensive care unit, collaborative care can minimize the risk of complications. Early mobilization is a key factor in reducing length of stay, average days on a ventilator, ventilator-associated events, hospital-acquired pressure injuries, and falls. ARIA, Jefferson Health, endeavored to combat risk by developing an evidence-based, progressive mobility program. The dedicated care professionals crafted a multidisciplinary task force and developed an implementation plan. New equipment was purchased to enhance patient mobility. Specialty walkers aided patients with portable ventilators, monitors, oxygen, and intravenous pumps, utilizing battery power sources. Ceiling lifts were also installed in patient rooms, allowing more complex patients to be moved without risking the safety of the staff. 1 year after the launch of the program, the results were impactful. The length of patient stay in the ICU dropped from 3.69 to 3.44. This difference represents a quarter-day decrease, estimated to save $162,000 monthly and $2 million annually. The mean ventilator days decreased from 5.90 to 5.57, representing a third of a day decrease. There were also 0 occurrences of hospital-acquired pressure injuries, patient falls, and staff injuries related to patient handling. For pioneering a patient-centered team approach for the critically ill, we are delighted to recognize ARIA, Jefferson Health, as the second-place recipient of the 2017 Delaware Valley Patient Safety and Quality Award. Blood transfusions are the most commonly performed procedures in U.S. hospitals. They are life-saving approaches for blood-related disorders and surgical interventions. However, there are limits to the effectiveness of transfusions, and they aren't as complication-free as once thought. Plus, transfusions are expensive treatment methods, and blood products as a whole have a limited supply. To challenge traditional thinking and advocate for safer, more cost-effective care, Jefferson designed a patient blood management, or PBM program. They formed an interdisciplinary team working with Specialty Care, an outsourced partner for patient blood management. The team implemented a new massive transfusion protocol. They performed real-time audits of transfusion triggers, lab values used to decide when blood is needed, and they provided scorecards to service lines such as neuro, spine, and cardiac surgery. Indications for the transfusion were also changed to reflect best practice guidelines. To eliminate blood product wastage, the surgical blood ordering schedule was evaluated and revised, resulting in a $57,000 decrease in wastage over a 5-month period. The patient consent form was also revised to include risks, benefits, and alternatives to transfusion. A separate refusal form was also created to provide patients with more options for blood product selection or outright refusal. The results of these initiatives were highly favorable. Analysis of data pre- and post-PBM program implementation showed significant declines in blood product utilization and length of stay across several departments, with significantly lower results in gastroenterology, neurology, neurosurgery, and surgery. In addition, there was also a significant difference in the prevalence of sepsis for patients who received any blood product versus those who did not in 2016. For their innovative efforts to rethink patient treatment and elevate the safety of patient care, we are delighted to recognize Thomas Jefferson University Hospitals as the first-place recipient of the 2017 Delaware Valley Patient Safety and Quality Award.